Welcome to the She Found Motherhood podcast. Today we're talking to Rebecca Tranter about her journey through pregnancy. She actually had quite a significant diagnosis in her first trimester, which she was not expecting, which really took quite a bit of time to adjust to. She is also a strength trainer and CrossFit trainer and is extremely active herself. And so she tells us a little bit about her journey through pregnancy and how she's adjusted her movement to accommodate her growing pregnancy. So we're really excited to chat today. She's got some great tips and tricks and really quite an interesting story that I don't want to give too much away before we get into it. So we will chat with Rebecca after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it. Hello, everybody. Today we have Rebecca Tranter. Am I saying that right?
You are.
Awesome. Joining us today, Rebecca and I met at the gym that I work out at and she coaches at Forge, and she was doing some classes and I took them from her, and she was so lovely and always so positive and always so helpful with technique. And then I saw that she was pregnant, so I thought, heck, let's get her on the podcast so she can teach us a little bit about her journey in pregnancy around strength training and CrossFit. She's also a registered massage therapist working at Absolute Therapy and Cascadia Massage and Health, and she also teaches some classes at CrossFit Zone, and she's a level 1 certified CrossFit trainer. So Rebecca, thank you for joining us. And why don't you tell us a little bit about yourself other than what I just told about you?
Awesome. Thank you so much, Alicia. I'm so excited to be here and talk about all this with you guys in your community. I've been, since the beginning of my pregnancy, I've been following along on your podcast and following your Instagram account and learning and taking tips and tricks from people in the community as well. So I'm so excited to be here and share my knowledge with everyone as well. But yeah, you touched on where I'm working and what I'm doing. I've been a massage therapist for 2 and a bit years now, which I absolutely love. I love working with people and helping people and working with mothers that are expecting as well. And then the gym is just a perfect little ally to that, where I can work with people to help them achieve their health and personal goals around health and wellness, because that's really my bread and butter and what I like to inspire in others. When I'm not at work or not at the gym, working out myself or training other people, love taking my little dog for a walk, being out in nature, hiking, all that kind of fun stuff. And currently I am 36 weeks pregnant with my first, and we're having a little boy. So we're so excited to meet him. I guess he can come any day now because I'm almost 37 weeks. We're getting the last few things together to get all that started.
Nice. Are you doing have you gotten that nesting instinct yet?
We're getting there. I'm currently in the baby's room with a half-built crib because we're missing a couple parts that we need to get. But getting there slowly.
Getting there.
But yeah.
Awesome.
Yeah.
Thanks for joining. Why don't we start a little bit with you're a very fit individual. So I got on the Zoom call with Rebecca and I'm looking at her from the chest up, and she looks no different than she did when I used to do the classes. She's still doing the classes. I'm not doing the classes because she's obviously maintained her health really well throughout pregnancy, and she has a really good background knowledge around how to do that. So we thought today we could chat a little bit about, if you are into strength training, CrossFit, how can you modify and keep doing those activities that you love in a way that as your body changes and from kind of a safety point of view, you can keep doing that throughout pregnancy. So I thought that she could use her vast knowledge and her personal experience, because she's literally going through it right now, to help guide people around those pieces of strength training and conditioning in pregnancy.
Yeah, great question. So the best advice that I got right away from the beginning, and my doctor is my family doctor, not my pregnancy doctor, is awesome. And he just said, the best thing you can do is just keep doing what you're doing. Because if you're not a runner, I wouldn't encourage going and starting to train for a marathon or anything. But doing exactly what you're doing is the best because that's how you got pregnant and that's how you were able to start growing another little being. So that was the best piece of advice that I could get from a medical professional. And then I also had my own experience through clients that I've worked with. And then I think you guys have actually done a podcast with Robyn Rayner from Tyrannis Mom Strong, who's a great resource for training and pregnancy and postpartum. I mean, she has lots of great resources there. But really, I found myself and have heard is the best is just to keep doing what you're doing. And early on in your pregnancy, the first trimester, some people have a little bit lower energy, some morning sickness sometimes, and things like that. Just doing what you can that's as normal to your normal routine, and then listening to your body. Thankfully, I didn't really have any morning sickness, which was nice for me. So I was able to keep up with it. And I didn't really, especially in that first trimester, really change much of my training for myself. There's some days that I felt a little bit more tired. So I just scaled back the intensity, didn't push as hard, lifted a little bit lighter weights. But for the most part, I felt pretty good in that first trimester and doing the same things that I was doing before felt good for me. But as I said, everyone's different and everyone has their own experience with what that first trimester looks like. So just listening to your body and trying to keep as much as a normal routine as you can because 9 months, although flies by, is also a long time to totally change what you're doing. So if you can keep as much normalcy, because after baby comes, I hear that there's definitely going to be some changes. So staying true to who you are and what you do and being able to keep going on with your fitness level is great.
Yeah, and we
And
talk about this a lot, but it's also really important. Kind of that movement in pregnancy really decreases your aches and pains over the pregnancy and makes your delivery, generally speaking, a little bit easier and that postpartum recovery a little bit quicker just because you're going into that experience healthier and a bit fitter and stronger, naturally speaking. But I think a lot of people also have a ton of symptoms in first trimester. So, yes, keep doing what you're doing if you're able to, but also have a lot of self compassion. And it's okay if you're not feeling awesome to therefore scale it back, as you said. So, I think that's really important for some people to remember because I was like you, I didn't have much symptoms. So, I was able to keep doing with my regular routines. But I have colleagues who felt like, excuse my French, ass. And they
yeah,
felt so bad that they couldn't keep up with their regular routines. And so I think it's depending on how you're doing, it's really important to have that self-compassion, but yeah.
of course. And YouTube is a great resource if you are having a day where you're not feeling inspired. I know that I've done it and you want just 10 minutes of some sort of movement just to get some movement in to help with those aches and pains. Because I find that if I don't move, especially for a couple of days, I feel more sore, more achy, more tired, more run down. So sometimes mentally, I didn't want to think of what to do or where to go with my workout or even just stretching. And you can just type in first trimester yoga, and there's like thousands of videos that pop up. And there's some really great ones. And sometimes you even just, sometimes I'd put one on and start watching it. And then I'm like, oh, I don't really want to do that. But then this woman is leading me through this awesome stretching, and I'm just doing my own stretching. So it's at least inspired something that gets you moving and gets you stretching and feeling good. I swear by cat cows these days.
Yes. Yes.
So
As
good.
do I, just generally.
Yep.
Cool. All right. So that first trimester, we talked about trying to stick with your regular routine as much as you're able to, scaling back on those days that you maybe don't feel as well, and making sure that you have some self compassion. And then you hit that second trimester, which oftentimes a lot of people actually get their energy back a little bit better, feel a little bit better. But that's also when our body starts really starting to make those changes. A lot of, especially in the first pregnancy, a lot of people don't even have much of a belly or anything in the first trimester. Somebody else looking at you wouldn't know that you're pregnant. But starting that 13, 14 weeks, that's oftentimes when our bellies start popping and our center of gravity, et cetera, starts shifting. What's your advice and what did you find during that period of time?
So for me, my second trimester, I had this awesome mom strength that kind of came out, or that's what I called it anyways. I was like lifting just as heavy as I was like pre pregnancy. I think I even hit like a personal best on a couple of my lists out of nowhere. I had this like, I don't know, weight moves weight a little bit or what's going on. But I had this also, yeah, like you said, refound energy and strength that I was able to do pretty much exactly what I was doing, if not more than before. Maybe that's the increased blood flow or blood volume that you have, or just a little bit of getting out of that second trimester. You feel like a little bit more secure in your pregnancy too, because we'll get into this a little bit later about my worries around the first trimester of my pregnancy. But yeah, there's all that mental side, especially with your first, like about around miscarriage and what if something happens and should I be doing this? Should I not be doing this? So I found that once you hit that like first trimester, end of the first trimester milestone, you get a little bit more confidence in your pregnancy and yourself. Maybe you're not showing to other people, but you notice like a little bit of a bump yourself or something like that. But yeah, the second trimester was, yeah, you got a bit more energy, you got a bit more pep in your step, feel a little bit more confident. You're getting close to that like anatomy scan where you got to get a little bit more information about the baby, see a little bit more. Yeah, the second trimester was for me a little bit of a kind of breath of fresh air and a little reset, and just kept going with it. And then, as you said, as you get through your second trimester, you do start to show. So for me, things that I had to modify, I started to notice probably about halfway through the second trimester, a little bit of that coning that we talk about. That's where like the middle of your abdomen protrudes forward, which is totally normal. A lot of people get really stressed out that it's not normal. It is totally normal, but just something to be aware of. So that changed some of my sit-ups and crunching abdominal exercises. Yeah, I was just a little bit more aware of it. Like hanging from a pull-up bar caused that for me. So I've just modified ring rows are a great exercise, or just putting a bar in the squat rack and doing some pull-ups that way. I found really good substitutions there. What else can you do? Some bent over rows, things like that, just to keep an eye on that if that's something that you're noticing is showing up a little bit more for you. Yeah, I don't know, just watching your body and paying attention to your body, I found is like the best thing you can do, because some women don't have that issue at all and some do. And sometimes it's not even, it's just like a little bit and you're like, is that it? I'm not really sure. But mine definitely, as I got a little bit further along, I noticed it a bit more. For me, like anything lying on my back crunched up, I kind of cone. So I've all my core exercises have turned into like bird dog, so on all fours, and then just watching it, making sure that I'm trying to use my deep abdominal muscles to engage my core as opposed to pushing out against and creating that cone. For the most part, yeah, if you watch yourself and pay attention to yourself, stand in front of the mirror when you do some workout so you can see what's going on, is a really good place to get your feet on the ground to pay attention to what's happening so you can just modify and take care of yourself. Skipping and like jumping for me were fine for a while. And then all of a sudden I started noticing like a lot of pressure, which I didn't enjoy. But then there's some women that run until they're like the day they give birth.
Yeah, and I think that's the one of the hard things is everybody's pregnancy is very different, and so you, like you said, really paying attention to yourself and listening to your body, and then reaching out for help if you need any suggestions. So a lot of us aren't trainers and don't have this extensive knowledge of alternative things, and so this is when somebody like you can be really helpful, or Robyn from Trans Mom Strong, like just reaching out and saying, "Hey, this is would you mind doing a session with me just to give me some suggestions? This is what I'm finding, and I'd love some alternate stuff." It doesn't have to be an ongoing thing, or it can be if you enjoy it. And but if you just need a few tips and tricks. And the other thing that can be really challenging and maybe more into the third trimester is how your body is shifting. We start releasing this hormone called relaxin, and so sometimes our pelvis shifts in different ways, or it can get a bit more uncomfortable. And so sometimes our technique, and also as our belly is growing, our technique has to modify a little bit to adjust. So that can be a really helpful thing, reaching out to, if you enjoy training and stuff, then reaching out to somebody for some great tips and tricks, right?
Of course. And there's Instagram's a great tool if you use it for the right things. But there's, if you ever message someone on there, I don't know if anyone's done that, or usually you get a response. You're like, hey, I've been watching your videos. You've been super inspiring. I noticed that you're pregnant and blah, blah, blah. This is what's going on for me. And then they usually respond and give you some advice or some kind of like free feedback and little tips and tricks there. So that's a great place to do it. They usually have tons of videos if they're like have a good social media presence. There's also a really great resource. There's Mobility Movement is a mobility app that you can download, but they have a Mama Bear pregnancy series and they actually talk about like tons of different movements and things you can do to modify them. And it's a woman out of Vernon who she does all the demos and everything so that they'll show you like an exercise, so like an abdominal exercise, and then show you all the different like ways you can modify it, which is cool.
That's great. Yeah. Yeah. So maybe we'll get your kind of top favorite resources and we'll add them to the show notes so people have
Awesome.
a sense. Because for most people, it's hard to differentiate what's a good resource and what's not a good resource. I think you could help sort us out. Now, no legal ramifications if it ends up not being a good resource. But let's go to the expert here for the resources. Yeah, that'd be awesome. Hey, Sarah. Do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules, though.
Oh, tell me about it. I was a medical resident at the time, and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the fourth trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back. So let's talk a little bit about third trimester. So we chatted about now you're growing even bigger, your belly's bigger, center of gravity may be off a bit. You're starting to release this hormone relaxin, which loosens your connective tissue that's allowing your pelvis to open up and shift as we move towards delivering our babies.
But yeah, third trimester, where do I start? I feel like I'm getting quite large, which is cool. Lots of kicks and movement, which is the coolest thing. I think it's amazing. Yeah, third trimester, I think you just kind of got to watch out for your belly and then intra-abdominal pressure. So you already are creating it with the little babe growing in there. So just being aware, and I think breath is the most important part for me, especially if you're into any sort of strength training. We tend to previously hold our breaths in our lifts, whereas that's not something we want to do as much. You don't want to increase that pressure. And so that's something that I did a little bit of reading on. And then I actually went to a pelvic floor physio as well, just to get a good assessment of what's going on and making sure that everything's good. And she suggested that just breathing when you're doing your lifting is really important because you're definitely going to need that during labor. So yeah, a lot of breathing and just making sure that I'm not like holding my breath through my lifts. I'm still lifting pretty heavy, not super heavy. I don't know. It's not a race anymore. You're not like challenging yourself against the old version of you. It's just moving so that you can prepare yourself for labor and delivery, making sure that you're healthy because especially with your first pregnancy, from what I've heard, could potentially be in labor for quite a long time. So it's a really long workout. So if you can keep yourself moving and keep yourself healthy so that you can continue that and prepare yourself as best you can for your delivery and welcoming this new little joy into the world, then that's what you want to be doing. Everything that I'm doing now is just gentle movement. I'm lifting a little bit lighter and just like I do burpees on a box because my belly gets in the way. I'm not really jumping up onto a box for, I think you could if you wanted to, but for me, I don't want to risk like not landing properly with my center of gravity being off and potentially landing on my belly. That just is not something that I'm interested in. So I'm stepping up onto a box. My pull ups are not pull ups anymore. They're ring rows or with a band pulling down from a bar on my knees. Yeah, just you actually got to get a little creative and just be like, hey, how can I make this movement look like this movement without doing anything that doesn't feel right? And then sometimes I'll notice like a little as your belly's growing and maybe depending on the position of baby and belly, sometimes I feel like, oh, that didn't feel very good. So halfway through the workout, I switch it up. I really like the bike right now. That's a really good tool. And then I'm still working quite a bit. So I find, like you said, with relaxing, I find I'm the opposite. I think maybe because my joints are relaxing, all my muscles are tensing up. So I'm really enjoying stretching right now. But I think everyone's like we keep talking to, everyone's a little bit different. So some people might feel that their joints are all like loosey goosey. And so maybe a little bit more like glute bridges and clamshells would help tighten that pelvis up for you. Whereas for me, I feel the opposite. And I'm like, oh, I need to stretch all the time. But yeah, I don't know. It's so difficult to give like a one word, like solid answer because everyone is so different depending on what you do for work during the day, depending on how you spend your evenings. I have a young puppy that we love and we're out walking all the time. So I'm always on my feet and working out and then standing for work. So I feel like I never sit down. But some of you have a desk job and work from home or aren't standing as much. So you probably feel the opposite of me and feel all loose and that you need to do some more strength training. So everyone's different. And that's like the cool thing about this pregnancy journey is that everyone experiences it different and everyone has their own ideas with it. So like we said, reach out for help and ask people and talk to your community and get as much advice and information as you can. Use Google if you want to, or use your friends
Just
if you
be
prefer.
cautious about Google.
Yeah, be cautious about Google.
Grain of salt. So I do pregnancy care, right? I care for pregnant and postpartum people and their newborns. And I did that for about 3 or 4 years before I actually got pregnant with my first. And the amount that I learned through the process of being pregnant and having a baby and having a newborn at home really shifted how I cared for people in their pregnancy and their postpartum. It gave me a whole new perspective and it gave me a huge amount of knowledge because we don't learn about a lot of the day-to-day stuff in kind of medicine, but that's what a lot of people ask about, right? Their poops and their pees and their sleep and their those we're not trained in any of that. As physicians, that's not our training, but that's probably 50% of the questions that we get, potty training in the toddler years, behavioral stuff, right? And so I found that going through that journey really gave me a whole big toolkit to draw from. Have you found that been the same way for you? Do you approach like, if you have pregnant clients now, do you approach them in a different way now that you've experienced pregnancy? Although it sounds like you're from a physical point of view, your pregnancy has actually been quite reasonable.
Yeah, for sure. I don't know. I find that the best way to learn is through experience and kind of doing. So this, like you said, it's been huge to just go through it on your own and you remember retain things better that you've picked up on your own or, oh, this is interesting. I don't know why I'm feeling this way. And then you do some research on it and figure it out and talk to other moms or like just bouncing ideas back and forth. And that's the best way to learn and gain information. So yeah, going through it has been huge because I didn't really understand what it was like before. Like you grow a human and your belly gets bigger and you have to modify and you know all that kind of stuff going into it and through schooling and through working with pregnant athletes as well. They share some insight too, but you don't really fully understand until you've gone through it yourself. Yeah, it would be difficult to give like sound advice, I guess you could say, not having gone through it on your own. Not saying that doesn't allow people to give sound advice because there's tons of great resources. I can't believe how many like books and shows and resources there are out there to learn about it. But yeah, when second time moms they like know all the answers and they have all these ideas and you're like, oh wow, how do you learn all that? And they're like, I've done it before. I already know.
Yeah, it's the
So
practical tips, right? It's those kind of like practical tips that you don't learn in books. You have all the theory, but then the actual like practical putting into practice what works, what doesn't work, you learn as you do it yourself, hey?
Yeah.
You and I were chatting before we started, and thank you. You're willing to share your journey because you had a little bit of an interesting start to your pregnancy, which you were not expecting, and added some extra, talking about learning, some extra learning to your journey. So I was hoping you could tell us a little bit about that journey that you've gone through.
Yeah. I'm super happy to share this now that it's been a few months. So for me, although we've talked about how my pregnancy has, for the most part, been fairly straightforward, and I guess I don't want to use the word easy, but yeah, a little bit. I didn't suffer from common like morning sickness or anything like that. But when I first did my initial blood work for my pregnancy, I found out that I am a type 1 diabetic. So as soon as I say that, everyone says, "Oh, gestational diabetes." And I'm like, no, not that one. The typically speaking, genetic or juvenile type of diabetes where your pancreas does not produce insulin or a very low amount of insulin. So you're actually required to take insulin to help lower your blood sugar. So within the first 6 to 8 weeks of my pregnancy, I got my blood work done and they said your A1C is very high. And me being very naive to knew about diabetes. I learned about diabetes in school, but me being new to that whole world, I was, oh, what's an A1C? And so at first we couldn't even understand or wrap our heads around what that even meant. So we went for some more testing, which further confirmed that yes, I am a type 1 diabetic. We'll see fully because I've only been pregnant since I've been a type 1 diabetic. So we'll see what my insulin needs and things like that are after. But yeah, very scary. Like you said, Alicia, earlier, Google can be a good thing and also not so much a good thing. We found out on a Friday, which doesn't really give you much answers in the medical world to waiting to just know what our next steps were. So yeah, I would say first trimester for my partner and I was really hard and really trying and lots of tears, lots of feeling of just like self doubt. And should we even be bringing life into this world if this is what's going on for us? Because generally speaking, with type 1 diabetes, they want you to have very good blood sugar control before you even think about getting pregnant. Whereas we were the opposite. We were pregnant and then found out about this. So we had no idea about how to even manage blood sugar. We weren't even managing when we found out because we hadn't seen anyone. And then just waiting to get in to see an endocrinologist and all that kind of medical stuff that goes along with it. But my spouse has been just amazing. I'm so grateful for him. I was, well, up until now, not a needle person, couldn't even think about needles. So it went from like being a fit, normal, healthy, what I thought person to all of a sudden I have this big looming type 1 diabetes diagnosis hanging over our heads. And then also thinking about bringing life into the world too with, oh, just, yeah, that first couple months up until that 20-week anatomy scan was really scary and a lot of doubt and fear around the whole process. So, yeah, it was really tricky. And yeah, I don't know what I would have done without his support. He was amazing. And I think he gave me my needles for the first 2 weeks because I was too scared to and couldn't even look at it. But now I'm like a pro. I just like sometimes do it at a restaurant, like sneakily at the side, just like, okay, I can do this. And now that we've had all of our scans and lots of monitoring, I think I have more appointments than I've ever had in my entire life. I went from being that person that hadn't seen a doctor in like years to all of a sudden seeing a doctor like every week.
Yeah, yeah, it's a lot, hey? Yeah, and what Rebecca was talking about, the 20-week scan, is that's the anatomy scan. And one of the things that we worry about when your sugars are not awesome in the first trimester is that's when baby is forming and all of this amazing work that creates a human being is happening. And sometimes if our sugars are really out of whack, then that can cause an increased risk of miscarriage, which is what you and I were chatting about before, but also abnormal development. So heart issues and a bunch of other stuff. And Rebecca got through that first trimester, and that's what she was alluding to earlier. Once she got through that first trimester, she was excited and feeling better in that second trimester for kind of exercising and stuff. But the anatomy scan is that scan that we look at babies' anatomy, so how they've developed and see if everything is looking as best we can, looking like it's developed normally. And then there's another heart scan for the baby a couple weeks later, usually, to make sure that the heart is looking like it's developed normally. And so I think that's what you were talking to. Once you got through those two
Yeah.
scans and you knew that all of the things that needed to happen had happened properly, despite the fact that your sugars were out of whack because you had no idea and no control over that at that point,
At that
um, probably just gave you that sense of relief and, okay, we got this now. Hey,
exactly. Yeah, it took a bit. That 20 we were really like the first 20 weeks was very slow moving. We just felt like every day we were just hoping things were gonna get better and or just not I guess not hoping things were gonna get better, but just questioning whether we're doing the right things. Are we like is our blood sugar control good? Are we doing enough? And then the hardest part too was just modifying your diet without kind of like I did the keto thing almost for a bit, which was like you're just I don't know, but it wasn't fully keto, so I was kinda like just eating a ton of fat and I didn't like everyone's, "Oh, have you gained weight?" I'm like, "I don't know if it's because 'cause I've changed my diet or if it's because 'cause I'm all of a sudden taking insulin, so my body's like doing this." They're like, "How do you feel?" I'm like, "I don't really know," because everything was just yeah, so all of a sudden I went from non-pregnant woman to a type 1 diabetic in my first trimester of pregnancy and now taking insulin. So trying to navigate all of that. And how do you feel about your pregnancy? I'm like, I feel okay, but I'm really worried about this. I don't know if this is related to this or if this is because of this or if this is separate from my diabetic diagnosis and all that kind of stuff. But yeah, my doctors have been great and my endocrinologist and all the nurses that I've been working with have been wonderful. And I have so many people that I refer to and talk to, but I have a really big support system, which is awesome. And my partner's been such a solid rock in this whole journey. I don't know what I'd do without him.
and
Yeah,
it's really important to have that kind of big support team, and especially when you're going through something like this, because this is like most people are diagnosed when they're a child, and then there's some this is very rare, guys. Just FYI, don't everybody start to worry that you're going to be diagnosed with type 1 diabetes in your pregnancy. This is very rare, but there
sure.
certainly are certain people who get mature onset or later onset type 1 diabetes, which is a totally different way of getting diabetes than type 2 diabetes. They're very different diseases, but it's most people like would have, okay, I'll figure this out over the next year. I'll figure out how to manage my sugars and check my sugars and all these things. And it takes a while to get into that groove and understand it and get to know your body. But then you've been diagnosed in the pregnancy, during which everything changes so rapidly at the best of times. And trying to navigate that all at the same time is it's pretty incredible that you're still standing here chatting and smiling with me, to be honest, right? Like this is a huge thing. Yeah. So congratulations. And thank you for sharing that. I think
Of
that's really
course. Yeah. It's funny. So I'm with the gestational diabetes clinic because it's a pregnancy diabetes currently. And it's talking to the nurse there. I'm like, so have you ever seen this before? And she goes, no, I have not. And I'm like, okay, yes, very rare to be diagnosed during. Usually I'll have some symptoms before, which is why they're like, what the heck is going on here? Usually I'll have some extreme thirst or something like that'll come up that will trigger you trying to figure out why you feel a certain way. Whereas for me, I think, yeah, I had a month period where I was like thirsty at night. So that's like the thing that keeps like replaying in my head of what's going on. But yeah, it took a bit of adjusting, or not a bit, a lot of adjusting, a lot of tears, a lot of not so positive moments. But we're here and we have baby that's about to come soon.
awesome. Thank you, Rebecca, so much for joining us today. And best of luck with your upcoming exciting journey.
Thank you.
So
We're
exciting.
we have our hospital bag packed and we're getting ready. So all
Nice.
that there,
Maybe we'll see each other in the delivery room.
never know.
Never know. Awesome. Why don't you're going to send me some of those resources that we are talking about? So we'll put those in the show notes. And yeah, if anybody wants to get a hold of Rebecca, do you have a public Instagram account?
I have a public Instagram. I don't really post a lot. I'm not a big social media person. There's more mainly just like dog pictures, lifestyle pictures, but it's Rebecca Tranter. And you can ask me any question and I will always get back to you about like health and fitness, or even if you're a type 1 diabetic and you have questions too, or gestational diabetic and you want to talk about some food ideas or anything like that. I'm a big foodie, so I'm all for figuring out food and things like that. So just let me know. And I'll pass along my email too. So if people want to send me an email, I can answer that way too.
Yeah, or if they want to touch base with you around doing some training or any of that type of stuff. Cool.
Exactly. Oh,
Awesome. Thanks, Rebecca. Have a lovely day.
thanks, you too.
Bye. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.